Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. Today, we're going to talk about DOs, Doctors of Osteopathy, the cool things that they do and how they help in the healing process. It's time to talk about it right now. When it comes to healthcare, there's lots of types of doctors out there. There's MDs, DCs, DPTs, DOs, and lots more. But for the sake of our video today, I wanted to share a really cool kind of doctor with you that you may have never heard of, or you may have heard of and not known what they do. These doctors are called DOs, or Doctors of Osteopathy, also known as osteopaths. The osteopath tradition is long and storied. It's really cool in that it dates back into the 1800s. And these doctors were considered bone and nerve specialists. They, along with the chiropractors way back when, really focused on how the body worked naturally with manipulation. Now, the osteopaths back in the day thought that manipulation changed circulation. Chiropractors thought manipulation changed nerve flow. Now, in actuality, when you get good manipulation, you're affecting the whole system, which includes both circulation and nerve. But over time, the osteopathic profession ended up becoming intertwined with the medical profession. And that was a great move for them because it allowed them to expand their scope, spread their wings, and do lots of things that they get to do today. So DOs now can still manipulate, although most don't. Most leave the manipulation to the chiropractors, but there are still some DOs that manipulate or move joints. They also work with basic family medicine, and then they can specialize in all kinds of surgeries, all kinds of different fields like concussion specialties or geriatric, meaning working on elder patient specialties. They really have all the same privileges as medical doctors do and can get the same specialties. So very cool group of people. And when you're finding a DO, if you're looking for one that has definite broad-based skills, you'll want to ask questions like, do you offer manipulations or soft tissue work? Or do you offer complementary care along to medical care? Those few questions will help you know if the osteopath is more of a broad-scoped doc, or if they're more of the standard medical type doctor where they just have a different degree, but they still follow all the same basic medical rules of let's look at medication first and then look at surgery, refer to PT, that kind of thing, versus in their offices, them doing the actual procedures of manipulation and rehab and stretching and things of that nature. So I hope that gives you just a little glimpse of what a DO is. They're a very cool kind of doctor. If you see a DO, give them a hug today and tell them that you love what they do. Now, if you have questions on what DOs do or any other questions about types of providers, please feel free to reach out to me directly, jim@ramoslaw.com, and we'll be happy to help you. We work with lots of providers of all disciplines and all specialties here, and so it's just been a pleasure of mine to get to visit with a lot of these folks, understand what they do, how they do it, and how they're taking care of people just like you. If this has been helpful also, please send it to someone. You can subscribe to our YouTube, listen to our podcast, The Ramos Law Difference Makers. You can find that everywhere. We'd love to just increase our community with people just like you, learning and growing and getting healthier every day. And on that note, always remember, your health matters.